Welcome to Going Through Health with Gordy and Zed.
Where wellness gets a fun twist. I'm Gordy Jenkins, a natural foods entrepreneur, and with me is Dr. Zed DeBout, our resident trained Stanford MD. We are former college swim teammates turned best friends, and now your guide to this crazy world of health trends and fitness hacks with a focus on getting the science right. Get ready for a wild ride. This is Going Through Health with Gordy and Zed. Today, Zed and I are going through placebos. Real, fake, really fake, fakely real. We will take that fake pill and tell you how we really feel. Then it's Did I Get Got, where Zed and I test each other's ability to spot the real from the absurd in a battle of wits before finally wrapping up, as always, with our fast fire questions. But, Zed, before we down this sugar pill of an episode, what have you learned while going through health this week?
Well, Gordy, I have a study called Transplantation of Chemically Induced Pluripotent Stem Cell-Derived Islets Under Abdominal Anterior Rectus Sheath in a Type 1 Diabetes Patient, Cell, September 2024.
I was hoping you would talk. I've heard so much about it. Everyone's talking about it.
But no, so this is hot off the Cell press, and Cell, one of the good ones. So basically, they found that stem cells reverse this woman's diabetes. This 25-year-old woman in China has become the first person with type 1 diabetes to produce her own insulin after receiving a transplant of insulin-producing islet cells derived from her own reprogrammed stem cells. So they also had a Nature article out about this and quoted her as saying after she's now able to produce her own insulin, how excited she is, and that she, quote, "I enjoy eating everything, especially hot pot." And I was like, what are you going to do? I mean, it's just very...
It's like, all right, I have to include that.
Yeah, first of all, you're doing her like a little bit dirty, but it's also endearingly human. Like first of the kind, bleeding edge scientific procedure, and then just being like, "Hey, can't wait to eat my favorite food again."
I know, I like that. That's a big win. So, wait, just so you can understand that they took the woman's own cells, and then kind of reset them to an earlier, more flexible state, like those pluripotent stem cells you were talking about, and then and those were kind of just blank slates, right? That can become almost any cell in the body, right?
Yeah. So basically, for a while, they've been experimenting and had ways and methods to make stem cells to bring cells back to this pluripotent state where they can become anything. So your parents you can be anything you want to be, and you're like, what about a podcaster? And they're like, except for a podcaster. But similarly, these cells, they have these methods where they can reprogram them to a stem cell state, these pluripotent state where they can become any type of cell. But this lab did things differently where they used a different set of small molecules. So again, a little bit of a different change in methodology from the traditional way. And so not to get too much in the methods, but basically they were able to take this lady's stem cells, make them insulin producing islet cells. And then they didn't put them back in her pancreas. They actually transplanted them into her abdominal muscles. That allowed them to monitor and potentially remove them if they needed to.
Whoa, that's super interesting. That's big.
Yes.
I mean, that is a lot. Where did this happen?
It's in China. So she's been insulin independent for over a year after following this procedure, and she's had stable blood glucose levels. She's no longer experiencing spikes and drops in blood sugar. So obviously, they'll need to see if they can replicate this and how applicable it is and how scalable it is in terms of commercializing and scaling up. But really, yeah, just fascinating and kind of borderline science fiction to be able to reprogram these cells and have her producing insulin again after implantation.
I'm glad you said almost science fiction, because our subject today is placebos, Zed. But the story I have for you up top feels almost like science fiction to me. It's adapted from a 1998 report from the New York Times, and some elements to me seem pretty far-fetched. There's some pretty wild things that happen according to this report and the studies that observed who I'm about to talk about. So take that with a grain of salt, because I do imagine things have been embellished or sped up, but the general gist of it is what I'm trying to get at here.
Gotcha.
I'm not trying to get someone's hopes up in a unrealistic way or something like that,
Gotcha.
But in 1957 in Long Beach, California, Mr. Wright lay in a hospital days away from dying. Cancer had overtaken his body with tumors the size of oranges in his neck, chest, and groin. His doctors had exhausted every treatment, and his situation was dire. He He was bedridden, struggling for every breath, with only days to live. But Mr. Wright wasn't giving up just yet. He had heard of an experimental drug called crocodile and was convinced it would save him. His doctors, including Dr. Philip West, were skeptical. Crocodile had no proven track record, and they doubted it would work. But when your back is up against the wall, Zed, I'm sure you're willing to throw some Hail Marys and try some things out. So at Mr. Wright's insistence, Dr. West finally agreed to give him the drug. And what happened next was nothing short of miraculous. On a Friday afternoon, Mr. Wright received his first injection. When Dr. West returned to check on him that Monday morning, he was stunned. Mr. Wright, who had been knocking on death's door just days earlier, was up and walking around, joking with nurses. The doctor later described the scene, saying his tumors had melted like snowballs on a hot stove.
Gordon Ramsay, where are the snowballs? And why is there water everywhere? Are you a moron? Yes, chef.
Yes, chef. In just a few days, the enormous tumors had shrunk dramatically, and within 10 days, Mr. Wright was discharged from the hospital, seemingly cured.
Wow.
Right? And this remarkable story was first reported in 1957 by psychologist Bruno Krapfer in his paper, Psychological Variables in Human Cancer, published in the Journal of Projective Techniques. Of note, none of the other patients who received crocodile saw any improvement. It seemed like Mr. Wright's belief in the drug was playing a key role in his recovery. But then, after 2 months of good health, Mr. Wright's hope started to crack. He read in the news that crocodile was being called a quack remedy, completely ineffective. And here's where it gets even more interesting. Crocodile was indeed a total fraud. The drug was invented. Yeah. How fraud it gets? Check it. It's very fraudy. The drug was invented by a Yugoslavian doctor, Stevan Durovic, who claimed it was derived from a horse's blood serum. It had no scientific backing, no proven mechanism, and clinical trials consistently showed it did nothing to stop cancer. The American Medical Association would eventually label it a hoax. But at the time, people were desperate for a cure, and many believed in its power, none more so than Mr. Wright.
I believe in crocodile since it came along.
That actually is exactly what you'd probably see it on commercials. Like some old lady running around with a golden retriever. I believe in crocodile. For sure. So almost immediately after reading this, Mr. Wright's health deteriorated, his cancer returned, and his symptoms worsened. But Dr. West wasn't ready to give up on the power of Mr. Wright's mind just yet. Mr. Wright, I want you to pick some lottery numbers for me, but make ever so certain that you think you are going to win. But he told Mr. Wright that a new improved version of crocodile was coming. And this time it was super refined and double strength.
like this version makes the first look like just Yugoslavian horse serum. It's nothing. But don't turn on the TV. Don't turn on the TV. Don't read anything. Don't talk to anyone. I need you to believe.
That's exactly right, Zed. Because this new super refined and double strength version of crocodile was just a placebo. It was nothing more than a saline solution. He's really playing God, this doctor. Anyway, still, Mr. Wright's belief was rekindled. He received the placebo injection, and again, his tumors shrank and his health improved. He was soon out of the hospital, symptom-free. The power of his belief had worked yet another miracle. The story doesn't end there. Unfortunately, Mr. Wright apparently was a fan of medical journals, and he just couldn't avoid reading the damn medical journals. Yeah, I was like, oh, look, it wouldn't hurt if I just took a glimpse at this medical journal, would it? But yeah, I don't know. Yeah, he's such a strong imagination. He could like melt his tumors overnight by like thinking he's taking something. Like it's like read a fantasy novel. You're gonna freak.
Yeah. You're gonna be able to fly.
Yeah, literally. Exactly. You're gonna turn into a wizard. A few months later, Mr. Wright read a final definitive report that exposed crocodile as completely worthless. So he just had to. He just had to. This time there was no saving him. His belief shattered. His cancer returned. And within days, he passed away.
Oh, Mr. Wright. Don't look a gift horse serum in the mouth, my man.
Yeah, exactly. Oh, he was so close, man. His He was moody, I bet, man. I bet one little thing could really change the trajectory of his day,
Yeah, no kidding. And his
better get it
life
started. Yeah, you better start the day on a good note or he's going to absolutely tank his day.
spiral.
But Mr. Wright's case is one of the most dramatic examples of the placebo effect, the power of belief to influence health. As Dr. Ann Harrington of Harvard describes, placebos are often lies that heal, tapping into the brain's ability to turn expectation into biological reality. The placebo effect is more than psychological. It can trigger the release of endorphins, alter the body's chemistry, and even cause real physical changes, just as Mr. Wright experienced. Modern science.
Babe, I lied, but it was a lie to heal. Don't you get that?
That's a good argument. That's the argument between researcher couples. Modern science continues to explore the mechanism behind placebos, but the case of Mr. Wright remains a powerful reminder of how deeply our beliefs can shape our health, and in some cases, even determine life or death.
Wow, absolutely wild. And I know you kind of posed at the beginning that seems maybe a little bit far-fetched and some things have been potentially embellished, but still. And we'll touch on some other stuff because there's genetics involved in the placebo effect. So who knows, maybe Mr. Wright just had the right genes for extra strong placebo effects. But anyways.
But Zed, that was subjective today. It's time for the objective. Objectify me, Captain.
All right. You asked for it. So I have a little story for you, Gordy. Let's use our Mr. Wright imagination, powers of imagination, and imagine that you have COVID and you're in the throes of full-blown infection. I'm talking body aches, fever, testicular atrophy, cancel all my plans, induced euphoria. Got all those?
Got him. Got it.
All right. You run into your old friend who's now a Harvard doctor and podcaster and chief healer of a growing cult following. You say, "What are you doing in my room? I'm quarantining." And they say, "I was in the neighborhood and picked up on your living Covida Loca vibes." And obviously that checks out. And so they go on to produce a little blue pill. And you say, no, I'm actually all good in that department. And they say, no, this is actually the most scientifically validated and efficacious treatment for COVID there is, aside from certain mystical rites, which you don't have the aura for. Swell, you say, and you use it as a suppository before they can tell you just to swallow it. It works anyways. And in the next couple of days, you notice your symptoms have resolved and you're feeling fit as a fiddle. After listening to their podcast the following week, they tell the story of how they totally hoodwinked you, and the COVID pill was actually just a benign little turd pellet from a deer that had eaten a bunch of beets. What dark and mystical forces are at play here? All right. Well, I'm glad you asked, Gordy. I'm sorry you had to go through all that.
No, what are the dark and mystical forces at play here?
Well, let me elucidate and pull back the curtain. So we'll start with the definition. The placebo effect is a beneficial health outcome resulting from a patient's perception and expectations of an intervention or treatment rather than the treatment itself having any therapeutic effect. So, for example, you covered a little bit of this with your saline injections for Mr. Wright, but other examples include sugar pills and then therapeutic rituals. So, for example, they'll do studies where they're comparing TMS, like transcranial magnetic stimulation, against placebo intervention, but they have to still put people through all the hullabaloo and like bells and whistles of a procedure. So it can be this whole therapeutic ritual and machinery, et cetera. It doesn't just have to be a pill or a saline injection, but basically something that provides the experience of an intervention or treatment.
That's interesting.
Also, similarly, like our old friends, snake oil and leeches, maybe not the most efficacious treatments back in the day, but just a person's expectations and beliefs going into being treated with those things can potentially affect the outcome. So similar mechanisms. I don't know how many of our listeners are into Reiki or like crystals or that kind of thing. Those things don't have to be scientifically validated as medical interventions for your beliefs about them to have profound physiological impacts. And then last interesting thing here with definitions is that the placebo effects are not limited to inert interventions. You can actually use real medications to generate a placebo effect. For one example is a dose-dependent response. So when the same dosages are given to patients, but the patients are told they're getting different dosages, you can actually see different physiological effects depending on the dose that the patient thinks they're getting, even though they're all getting the same dosages. Does that make sense?
No, that totally makes sense. And I feel like I kind of do that with my supplements, because I feel like supplements is like a perfect example of like one of those things that, you know, there's a lot of science and there's emerging studies in support of a lot of it, but I'm guessing most of the instant benefits are the placebo effect from it, especially when you actually get into some of the supplements. For example, I'm taking, it takes weeks or months for them to actually have a therapeutic benefit, but even just having it one time the first week, before I even read that, I was already feeling better, not knowing that it actually might take a little bit to start having effects. So I totally get that, and I always go a little bit extra, because I'm like, if I undersell myself, whether it's actually biologically relevant is different rather than I thought that I know I'm getting enough. So I totally get that.
Yeah, no, and that's well in line with a lot of the studies we'll discuss here. And then briefly in terms of mechanism, we'll get more into this later on, but they're really these complex biopsychosocial phenomenon, and they've elucidated numerous different neurobiological pathways and brain regions involved, and we'll do more later. But again, just another example. I know how familiar you are with Harry Potter by this point. I think it's in, I forget which book it's in, but Harry Potter pretends to give Ron that Felix Felicis, that magic lucky potion before the Quidditch game. And Hermione's like, oh my God, like you gave Ron the potion. And Harry's like, no, I didn't. I just pretended so he would think I gave it to him and do well. And of course, Ron had played really well. And then he got pissed at Hermione for thinking he couldn't have played well without the potion. And then it was a big thing. And then he ended up like hooking up with Lavender for a while, and then Hermione was mad and sent the birds after him.
Oh my God!
Yeah,
what?
And all because of a placebo.
But Zed, I have to stop you. It's the Harry Potter references are becoming. Predictable sounds has a pejorative sound to it, but I actually made a little sound drop for you, just so that so we can play it whenever you have to. Not have to.
I have
to get to mention your Harry Potter. So I just want you to take a listen to this real fast. This is for you, buddy.
You're a wizard, Zeddy.
You're like, oh wow, you're a whistler, Gordy.
That it took me. You don't know if that took me 45 seconds or it took me an hour, because let's just say 45 minutes. 45 minutes of it we're learning trademark law and parody law. And let's just say I might have been able to whistle it better, but did I want to get it exactly right? No. No, I had to be loose with it, Zed. So don't worry, I'll play it again for you later.
Okay. Well, now that I have an
I'm sure it's going to come up again.
All right. Well, all right. Back to placebo effects. Just want to highlight a couple distinctions. So as we spoke about, the actual placebo effect is the actual physiological or psychological response following administration of a placebo, which is generally an inactive substance or treatment, although it doesn't have to be. So that's a little bit different than the belief effect. And there's a lot of overlap between these, but the belief effect is specifically related to the patient's beliefs in the efficacy and or qualities of an intervention influencing the outcome, regardless of the treatment's actual properties. So, for example, in Mr. Wright's case, there's a strong belief effect there where he believes that Creboigan, or what was it?
Cryobiazin
would heal his tumors, and so there's that strong belief effect that influences the outcome. And then,
do you remember? I meant to mention this a second ago, but then the Harry Potter drop got me. In halftime, Space Jam, the team's getting their butts kicked, and then I just thought of this. I don't know why I didn't think of this before. And they go into the locker room and they give like Michael Jordan's like secret drink, secret like special formula. And it's just like water though. And everyone drinks it. They don't know it's water. And they all get pumped up and they go out there and they like beat the Monstars. And they,
perfect.
There we go. That's a perfect placebo right there.
I was literally trying to Google search for placebo instances in movies, and it was absolutely useless. But that one would have been perfect. Yeah, I was racking my brains, but no, that's perfect. Well, not as good as the Harry Potter one.
Do you want me to? Do you want to say it? Should I stop and just let you say it?
Welcome to the jam.
There we go.
Okay, then the mindset effect, again, overlap with the other two, with placebo and belief effect, but this encompasses the broader psychological influences where a patient's overall mindset or an individual's overall mindset, and that includes optimism or positivity or negativity, can impact their actual physiology and health outcomes. All right, so what we're most familiar with in a research setting is the use of placebos in clinical trials. So when you're trying to measure or research the effects or efficacy of a drug, you'll often have these multiple groups that you're testing with the drug. So you'll have a control group, and the placebos are used in those control groups to distinguish the effects of the active treatment from the placebo effects. And then you'll have this blinding, these double blind trials where everyone is blindfolded and spun around in a circle 5 times. Nah. It's where neither the participant nor the researcher knows who receives the placebo versus the active treatment. And that helps minimize bias. So again, everyone giving the pill and everyone taking the pill, no one knows what the pill is, but
Right.
hopefully they all think it's the real pill. And then you're comparing the active treatment group, so the group that's actually getting the medication, to the placebo group that's getting the sugar pill. And that allows researchers to kind of assess the efficacy of the new drug or intervention. But I just think it's interesting because in drug trials, you're really kind of measuring expectation of the drug, expectation of the effects of the drug versus the expectation plus the effect. So, and then there's that kind of delta. So you're not measuring, it's not the baseline of no drug versus the drug effects, if that makes sense.
No, it's super interesting. It's like, no, I'm just seeing it as like a bar graph where like it's kind of like a stacked bar where a portion of it is due to this, and then the other portion is due to that, almost, if that makes sense.
Totally. And then, yeah, so placebos are used all the time in research, but they're also studied in of themselves. So a couple of compelling examples from clinical research. So pain relief, a study demonstrated that placebo treatment can actually activate your endogenous opioid systems, leading to actual pain relief. So you don't even have to take an opioid. You can just take this placebo and you will activate those opioid systems. And then another example that's in the literature is Parkinson's disease, where researchers demonstrated that placebo treatments actually led to increased dopamine release in the brains of Parkinson's patients, improving their motor symptoms. So without getting too much in the pathophys of Parkinson's, it's basically a depletion in areas of your brain that produce dopamine. And so to actually see dopamine release increase in Parkinson's patients' brains via placebo is wild.
It's just it's just crazy. It really is just wild. I was just thinking, like, what if we like went on this like weird smear campaign against Ozempic on like TV and stuff where like it doesn't work, it doesn't work.
Yeah.
It'd be such a fascinating, like, have a giant population and then just to see like what the actual effects are. Do we see like a trend of like people having it lose efficacy? That would be super fascinating, and that just like brings me up to, or just got me thinking about just society in general though, and just like how like influenced we are by information and how it can affect our reality, and just like how kind of scary that is, that probably not even accounting for how much we're being influenced, you know?
No, it definitely, this is very much a fruitful kind of shower thoughts episode because it gets you back into sort of like psychology and 101 and all that stuff.
Like
and,
philosophy and psych 101 about
exactly.
that level. Yeah, totally.
All right. And then the last sort of one of the last examples from clinical research, and we'll cover a couple more later, but is an irritable bowel syndrome. So not to be confused with irritable bowel syndrome, which is where I pretend that I have IBS to get out of going bowling. They found that in IBS patients who knowingly took placebos still reported symptom relief. So another level where the patients knew they were taking the placebo. They knew it wasn't real, but it still helped decrease their symptoms and increase their symptom relief, which is wild.
That's really wild to me, because I don't know. You could just go in. I feel like I could go Inception and forever there, but like, what? I don't know. What is it then? And then what is the information to you if it does not register the same biologically? Is it just words without meaning? Like, who are you really believing? Do you not believe tech? Like, is there some I don't know. It's perplexing to me.
Yeah, we'll get a little bit more into it, but a little bit of it gets back to classical conditioning, where it's this almost subconscious conditioned response where, sure, someone tells you it's a placebo drug, and this is one of the proposed mechanisms, but you're the very act of taking the pill, you have this conditioned response to medication and to pill taking, to that ritual that your body then expresses these pain relief mechanisms, which is wild.
That's super fascinating. Very cool. I didn't. Sorry, I didn't expect all these tangents, but it is just like you said. It's really makes you think a lot about what is reality. It's just interesting.
100%.
Well, Zed, is this a good time to hear from one of our sponsors?
No time better.
All right, good, because back when we were the Jock and the Doc, iteration 1, we had this sponsor, and now they're back again. So let's take a break and hear from them. And today we are sponsored by the only wearable health tracker that tells you what you want to hear, the Placebo. Built like a normal fitness watch, the Placebo calculates stress levels through HRV imbalances from the previous day. If it sees that you've been stressed, rest assured, no matter how shitty you sleep, you'll wake up to your Placebo telling you that you got 10 hours of sleep and you're the healthiest, smartest person in the world. Never let the truth get in the way of your happiness with the Placebo. And for the home fitness enthusiasts, be sure to look out for the Placebo Flex. You get a free set of realistic-looking fake weights if you order today. That was kind of wholesome.
Very wholesome.
It sounded like listening to like a 10-year-old me now that I'm looking back. My face is red. Can you? Sorry, people. That was one we recorded in our early days for our sponsor. So, whoa, welcome back. Be sure to subscribe, follow, and rate us 5 stars on Spotify, Apple Podcasts, and YouTube. New episodes Monday morning at goingthroughhealth.podcast on Instagram.
All right, Gordy, we are talking about placebos. I think it's time to break down our impressions and share some asides as part of our assessment.
Sorry, Zed, I had to take a pause because I almost laughed into the microphone. God forbid I give you that satisfaction on recording. Zed, you can't talk about placebos without mentioning the nocebo effect. I think it's nocebo. It's nocebo. But nocebo. We'll see. We'll see. Anyway, nocebo effect. So we know the placebo effect, where people feel better after taking a fake treatment because they believe it will help. But what happens when you expect the opposite? When you believe something harmless will kill you?
I think that's my dog's constant state of existence. poor thing.
Poor
Go ahead.
Well, that's called the nocebo effect, and it's just as powerful, but far less friendly than man's best friend. This is interesting, Zed. In a study by neuroscientist Dr. Fabrizio Benedetti, it's definitely nocebo.
It is, I was going to say.
It's nocebo. Dr. Benedetti, detailed in his book, Placebo Effects, Understanding the Mechanisms in Health and Disease, researchers conducted an experiment with people who had severe lactose intolerance. These individuals couldn't digest lactose, so whenever they consumed dairy, they'd experience serious digestive issues like bloating, stomach cramps, and of course, in true GTH fashion, peeing out of their butts.
Bless.
Mm-hmm. Here's the twist. The researchers actually gave them a lactose-free drink, but told them it contained lactose. And what yeah, right? Petting his cat in his chair next to the fire. Yeah, because what happened next was remarkable. Even though the drink contained no lactose at all, many of the participants reported experiencing the very symptoms they feared: stomach pain, bloating, and yes, diarrhea. Their bodies reacted as though they had consumed lactose, even though they hadn't. Why? Because their minds expected the symptoms, and those expectations alone were enough to trigger a physical response. This is the nocebo effect in action. The nocebo, sorry everyone. The nocebo effect in action. So thanks everyone for participating in this study today. Please take a clean pair of pants on your way out, and we will email you when we publish.
It is definitely kind of a fun revenge prank if you discover a lactose intolerant person ate or drank something of yours right after the fact and they believe you and you're like, oh damn, I'm surprised you finished my cashew milk latte. It actually has 100x the lactose of a regular latte. Enjoy.
Yeah, it's just lactose concentrate in there. So the studies didn't just reveal how powerful the mind can be in shaping physical symptoms, it also highlighted the importance of belief and expectation in medicine. And while the placebo effect shows us how we can heal, the nocebo effect demonstrates how fear and negative expectation can cause harm, even when there's no actual danger. research has shown that the nocebo effect can happen in many situations. People who believe they'll have side effects from a medication are more likely to experience those side effects. Even fake electrical shocks have caused people to feel pain when they were told it would hurt. It's a powerful reminder of the mind-body connection and how our thoughts. Are you laughing at the idea that they're going to be like, "Hey, this electric shock is going to hurt"?
You're gonna feel this.
Wouldn't want to be you right now, but just hold tight for a second here. Yeah, no, exactly. But yeah, it's true, Zed. It's a powerful reminder of the mind-body connection and how our thoughts can influence our well-being in ways we might not even realize. So the next time you're expecting the worst, remember, Zed, your body might just take your word for it.
It's frustratingly kind of so true, because I'm just used to this idea of, like positive attitude, like growth mindset, blah, blah, blah. Oh, don't go in thinking it's going to suck. But it's wild getting to the actual biological mechanisms of how these things work, and that they do actually impact your physiology. And something as crazy as being told something's going to hurt when it's benign. And again, total stupid shower thought, but it's
I know.
It's wild.
It's crazy though. It really is. So, Zed, those are some things that I found interesting, but what are some things that you found particularly compelling this week?
Yeah, sort of like we said, there's a ton of cool things involving everything from philosophy to psychology and neurobiology and even genetics. But here are a few tidbits. So vaccines, this shouldn't be problematic, but there's a study examining the association of vaccine-related mindsets and post-vaccination antibody response side effects and effective outcomes. And this is in Brain Behavior and Immunity in October 2024. But basically, in the study, the researchers measured what they described or qualified as overall positive vaccine mindset, and then specific mindsets regarding the efficacy of the vaccine, the body's response, and then side effects to the vaccine. So the point was they were trying to determine whether vaccine mindsets before the vaccination predicted things like antibody response, side effects, vaccine-related stress, and then effective outcomes. So affect, like general stress or sadness and happiness. So they found, with specifically the side effects mindset, the mindset that vaccine side effects are a sign that the vaccine is working, those positively predicted stronger antibody response at 1 and 6 months later after the intervention. So they go on to state that this finding needs replication, of course, but that it's actually consistent with previous research from Howe et al. In 2019, suggesting that side effect mindsets are associated with more positive immunological responses to oral immunotherapy treatment for peanut allergies. So just to zoom out for a second, basically, if you're getting this vaccine and you attribute the experience of side effects like fever or nausea or whatever the case may be, that, this must mean the vaccine's working, it's taking effect in my body, it's doing what it's supposed to, that those mindsets actually positively predicted stronger antibody responses. So your actual immunological function was ramped up to a certain extent. Which,
there was an old Listerine commercial. It's like the burn means it's working, and I feel like that's kind of what they're trying to say.
Yeah.
You know?
the awful, debilitating side effects mean it's working, and you're getting better.
You're good to go. That's fascinating. So the study was that people who believe side effects were a sign of the vaccine working had a stronger antibody response 6 months later, like actual antibody response. That's crazy. That just really makes you. Yeah, it's like, how much of a role does our brain play in our immunity?
Yeah. What is real? What is going on?
What is this?
All right. So this next thing I have for you. Hey, yo, what if they know that we know that they know it's placebo? So this gets back a little bit to that IBS study we talked about before, but this study, open label placebo versus double blind placebo for irritable bowel syndrome, a randomized clinical trial. And this is Kapchuk et al. 2021. But basically, like we covered, it's commonly believed that blinding the treatment assignment is necessary for placebos to have an effect. So patients in the research, they don't know whether they're getting the real pill or the placebo. However, they found that placebos administered without concealment, basically they call them open label placebos, but the patient knows that it's a placebo, they have recently been shown to be effective in some conditions. So this particular study had two objectives. They wanted to figure out whether this open label placebo treatment is superior to a no pill control. So basically is telling people they're getting a placebo, does it work better than just not giving them anything? in irritable bowel syndrome. And second, to compare the efficacy of that open label placebo against a double blind placebo. So that traditional, not telling them whether they're getting the real pill or the fake one. Does that make sense so far?
Yeah, no, that makes sense.
Okay.
That makes sense.
So they found that participants treated with the open label placebo, here, take this placebo, it's placebo. They reported clinically meaningful improvements in IBS symptoms that were significantly greater than those on the no pill control. So those that got no pill at all. They also found that the open label placebo and double blind placebo, that traditional placebo, had similar effects that did not differ significantly, suggesting that blinding may not be necessary for placebos to be effective, and that open label placebos could play a role in the management of patients with refractory IBS. Crazy.
It's so wild because it just be like, what are these people with IBS stupid?
well, don't clip that.
But that's I mean, it's like you think it's like why it is so interesting.
Yeah, it made me curious. What would your placebo setup be? So it's a placebo. So what are you taking? What's your form factor? Your route of admin? Your ingredient? What are you taking for your special placebo pills?
I think that would be like the most effective. Like, what would be the? I wouldn't want to inject anything into myself because I'm not like familiar with that. So that, I mean, but that would be the way I'd be like, oh, holy shit, this is really
this is
work.
doing something.
This is gonna work. I think that would be a big one. Like if I had to, like or I think like maybe like an aerosolized like mist. Like if it was like like what like the villain from like Scarecrow or from Batman did, Dark Knight Scarecrow or whatever. It's like, then I turn into like a scarecrow or something, and then go to the Wizard of Oz. I don't know, whatever you did.
Yeah, that does seem like something that works. Basically, an inhaler kind of thing, almost.
I wonder if there's any group of people that placebos don't work as well on due to their pre-existing like thought beliefs and structure,
That could I saw studies examining genetic predisposition to placebos, which do exist, which we don't cover here, but is again fascinating that you could genetically be more likely to experience a stronger placebo effect than others. But yeah, I'm not sure about the more psychosocial or basically foundational mindsets that would go into that either. So, but yeah, I'm sure they do.
Cool.
All right, so last little tidbit here, and again, I promised we talk a little bit about mechanisms. So this comes from a Lancet article in 2010, Placebo Effects, Biological, Clinical, and Ethical Advances, but basically detailing some of these neurobiological mechanisms, still relatively little understood, but there's a multitude of different mechanisms with a variety of different neurotransmitters and neuromodulators involved. So just to take a couple. So for example, in pain, which is particularly susceptible to placebo effects, but they found that it acts via the activation of endogenous opioids and dopamines. And then Parkinson's, we talked about the activation of dopamine in the striatum and changes in the activity of neurons in the basal ganglia and thalamus. And then in depression, there's actual changes of electrical and metabolic activity in various brain regions, including the ventral striatum. And then a last one here, in cardiovascular disease, they actually see with placebos a reduction of beta adrenergic activity of the heart. So those are just a handful of mechanisms with their related disease and system. But again, there's a bunch of different ones, and they're still really trying to figure out what exactly is going on here.
Oh, this is cool. That's really interesting, Zed. But Zed, here's the kicker. They don't just work for pills, as you've mentioned. They even work for surgery. In one famous study conducted in Texas, doctors performed fake knee surgeries to see if the placebo effect could work in such an extreme case. Patients suffering from severe knee pain were divided into 3 groups. One group had their knees scraped, the second group had them washed out, and the third group received sham surgery. In the sham surgery, the patients were sedated, small incisions were made in their knees, but no actual procedure was performed. The doctors just pretended to operate, which is something I feel like I could be really, really, really good at. And here's the kicker of the kicker. 2 years after the surgeries, patients who had undergone the fake surgery reported just as much pain relief as those who had the real operations.
Wow.
They believed that they had been treated and their bodies responded accordingly. Isn't that crazy?
It is.
That something like as invasive as surgery can have a placebo effect when the mind just expects it to be healed.
Man.
It is one of the most astonishing demonstrations of how our beliefs can shape our physical health, and it has sparked ongoing debates in the medical world about how much of a healing is mental. Also, was this ethical? It sounds sketchy, Zed, right? But the patients were also fully informed that they could be assigned to the placebo group and receive a sham surgery. So they had to agree to this possibility before participating, which I would argue is that it kind of takes away the shine of the placebo, but it really doesn't, apparently. Apparently, the blinding isn't as much of a big deal as you would think. But like, I feel like it would really come down to like what we were talking about earlier, whether you're like an optimist or a pessimist. And I think that I would just be like, well, I definitely got the sham surgery, and like just assume it's the sham surgery the whole time, no matter what, or something like that, or like however you're thinking, or if you're optimistic. If I'm an optimist, I'm like, oh yeah, maybe. So I just really wonder what kind of like mindset, or what kind of general disposition makes you more susceptible to these effects.
No, it really is wild, and I guess of any of the studies, I'm not overly surprised that it worked for surgery, just because it's an even more perceptively invasive, sort of involved, complicated procedure, and they found that the more complicated or kind of not all consuming, but involved the procedure is, or the intervention is, the stronger the effect can be, just because you have more expectations, or kind of like you were saying, if you would inject yourself versus taking a pill, you think more is going on there. But yeah,
that's it. It's almost like a sunk cost fallacy of your body. Like you've like invested more pain or like time or discomfort or all of this,
right?
Like I got to get something.
You expect
out of it.
more. Yeah, totally. Yeah, wild.
But hey, etymology wise, placebo comes from Latin, and it means I shall be acceptable or pleasing. So it's from placere, to please. So placebo means I shall be pleasing. So
yeah, we're kind of the placebo boys, the placeboys.
Placebos, the Placebos,
the Plache boys,
Plache boy. All right, Zed. But before we wrap up, let's synthesize this info. Dr. Zed, what are the GTH Big Three Bangers?
All right, so glad you asked. Here's the plan with the GTH Big Three Bangers of placebos. All right, number one, to think or not to think. Therefore, I am, or maybe not. So it's confusing. And again, kind of a shower thoughts episode. But placebos are these complex biopsychosocial phenomenon, and they demonstrate that our conscious and subconscious perceptions, beliefs, mindsets, expectations, those all play roles in impacting our very physiology. So maybe it shouldn't be too much of a surprise that benign or inert or external signals can have such powerful biological impacts. For example, like fight or flight. So if I'm at your house hanging out, and out of the corner of my eye, I see a big hairy thing running at me, I'm going to know, oh, that's probably Gordy. So I'm not going to freak out. And you're not even that hairy. But if I'm in a strange forest and out of the corner of my eye, I see a big hairy thing running at me, I might freak out and get this huge fight or flight response, because I think, oh, Gordy's here in the forest and he's angry. No, I would think it's it's like what is the now I'm blanking on his name.
Saber-tooth tiger coming in on you or something.
Yeah, saber-tooth tiger or a bear or whatever. But basically,
was the word you were thinking of was bear?
No, it was what's the guy?
What that really popular animal with brown?
This isn't going to be great for our listeners, but the creature that's like, oh, Sasquatch.
Oh yeah, I know Sasquatch.
but basically, your perception of this thing out of the corner of your eye affects your physiology and either ramps up your fight or flight system. But I don't know, did that make sense as an example of how you perceive the world affects your physiology?
Yeah, no, absolutely does. Like it could even be like take it even further, like almost a what's the word, subconscious stimuli or stimulus or something like that.
Yeah. And so, that all to say that perceptions and our surrounding frameworks shape our experience, but they also trigger real physiological changes inside of us. All right. So that's number one. Number two, great expectations. So it's important to recognize the power of positive expectations in enhancing health outcomes. So whether you are a patient or a caregiver or a clinician, fostering that positive outlook and belief in the effectiveness of treatments can really potentially amplify their benefit. Not trying to be irresponsible here and suggest promoting blind positivity or willful ignorance, but really cultivating a hopeful and supportive treatment environment can really have a measurable impact. So like Dr. Frankenstein being like, yes, you were dead, but you have been reanimated. And this means the procedure was a complete success and you are healthy and normal and will seamlessly adjust to society. So I know
Everyone likes you, buddy.
everyone likes you.
Frankie, you're going to be great. You're going to be
you're
great.
handsome.
Yeah, you're so cool. Everyone's going to be so nice to you.
It probably wouldn't have hurt.
wish. I know. Dang.
But yeah, it's not just applicable to health interventions or reanimation, but also the very mindsets we apply to all kinds of stimuli. So like stress, for example, like you're going to the dentist, so you can either go in being like, all right, this stress that I'm feeling, this is a powerful, helpful physical state that enables me to focus and rise to the challenge and shows that I care about my teeth health, versus, oh dear, this is torture. And plus the stress, which is bad. I might as well take out all my teeth and keep them for my dental records because I'm dead. And if I don't die, I'll need to move somewhere where there are no dentists, like England, maybe. So, give Australia a break for this episode.
That's cool.
But basically, additional like practices like mindfulness, meditation, and cognitive behavioral techniques can all be integrated into your daily life and benefit you as well. So that's great expectations.
Cool.
All right. Lastly, just because you believe in magic doesn't mean you'll live forever. Just ask Voldemort.
Oh, there it is, Zed. Hold on one second, everyone.
You're a wizard, Zeddy.
I'm sorry. You're going to have to pay the tax if you're going to talk about it. You got to pay the tax.
Yeah, it really is a trade-off. But yeah, so basically... all right.
Sorry, did I really take the win?
You did. This makes it way less fun.
I'm sorry.
So although research has demonstrated objective pathways and mechanisms of placebo effects, the majority of evidence still suggests that placebo effects do not alter the pathophysiology of disease. So, for example, cancer, while in Mr. Wright's case, that may have been a little bit embellished, but research shows that primary effects have to do with the patient's subjective experience of the condition and the side effects of treatment. So pain, nausea, etc. But there's minimal evidence of specific tumor shrinkage or cancer cell targeting, etc. And then it's also important to remember, and this goes for every episode, every science investigation ever, but what we think we know will very much continue to evolve. So it'll be exciting to follow along and kind of learn how powerful the mind-body connection can be, and hopefully which Hogwarts house we belong to.
Well, come on, tell us. Which house are you in?
Well,
give us like a quick answer. We'll have you do a whole episode on your thought process behind it.
Well, not to get too much into the author and her own problematic views, but on the website, if you go to the official Harry Potter website, you can actually figure out which house you would be assigned to, and it said Ravenclaw for me, which I'm fine with, I guess.
That's a very Ravenclaw answer of you, I feel like. Like being okay with being a Ravenclaw just means you're a Ravenclaw. That's cool. You're way more than a Ravenclaw. Come on. And Ravenclaw and Hufflepuff might as well not exist. You know that.
Might as well not.
Oh, sorry. Trigger warning. But what that really is, though, is healthy.
Now that's healthy.
That was just healthy banter, Zed. Ravenclaws deserve a spot in this world, too. I just didn't know if you were proud of it. I didn't know if I was supposed to make you feel better about the fact that you got Ravenclaw or not. But that's just the Gryffindor in me.
All right, go ahead.
All right, well, thank you so much. But now let's shift gears and get a little more playful.
More playful.
I feel like we're being a little too serious today. So now it's time to do a segment we like to call Did I Get Got?
Well, did I get got?
All right, folks, welcome to Did I Get Got, where Zed and I try to separate the real from the fake, because in the world of placebos, sometimes it's hard to tell. Here's how it works. Each of us will pitch 2 wacky remedies or medical oddities from the past. One is real historical practice, and the other is faker than a Yugoslavian horse-derived cancer medication. The other person has to figure out which one's legit and which one's just a proverbial sugar pill. Ready to test your instincts, Zed? Let's get started with Did I Get Got?
Well, did I get got?
All right, Zed. I have 2 ancient wacky cures for you. Let's see if you can spot the real deal or if you're about to fall for a placebo. And by that, I mean a fake. Because placebo, as we know, has a real effect. But anyway, time to put those instincts to the test. Okay, Zed, first I have for you crocodile crap contraceptives. In ancient Egypt, women believed that inserting dried crocodile poop into their bodies, you know where, Zed.
Is it their
would-
butt?
Nope.
Oh.
The front.
Oh.
Would the front medical podcast would prevent pregnancy. The theory was that the dung would act as a barrier or create an unfavorable environment for conception. It was considered a top-tier contraceptive of its time. All right, I'll let you play around with that in a second. Think about that. Option number 2: slug slime for baldness. In the 17th century, people believed that spreading the mucus of slugs and rubbing it onto your scalp could stimulate hair growth. It was the thought that the moisture of the slug had invigorating properties that would bring your hair follicles back to life. It's time to make the call, Zed. Crocodile doo-doo contraceptives or slug slime for baldness. What do you think? Which one's real?
All right, this is tough because I also have a slime-related cure in one of mine. Oh, the crocodile one is just so nasty, but I can also see it working really well for slightly different reasons than they discuss.
Yeah.
All right, I'm gonna say, but that would also be pretty like messed up of you to even like think up. Even you're not that twisted. All right, I talked myself into that one. I'm gonna say the crocodile one is real and the slug slime is fake.
All right, let's look at the board.
Whoa!
Correct. That is true.
All right.
4,000 years ago, doctors advised as a method of contraception mixtures of crocodile dung and honey to be left in the vagina for long periods of time.
Wow. Well, the honey kind of changes things, but
Oh
damn.
yeah, I didn't mention that. Sorry. But that's something right there, Zed. So
That is something. All right, your turn. Can you tell if this is the real thing or fake as placebo? Let's see if you get it right. Which one's real? Which one's fake? You ready?
I'm ready.
All right. First one, the royal touch. In medieval Europe, an intervention whereby French and English monarchs touched their subjects, regardless of social class, with the intent to cure them of whatever ailed them. I won't say what they touched them with. If I know those kings like I think I do, it was either a very short pole or a very long one. But no. It was most commonly applied to people suffering from tuberculosis, cervical lymphadenitis, better known as scrofula or the king's evil, which resulted in the common appearance of the patient's enlarged neck. This is supposed to have caused the sufferers to have a pig-like appearance. With my royal touch, I release the peasant from the pig spell. All right. So that's the royal touch. Next one. This may sound a little familiar. Snail unguent for sore throats. In medieval Europe, the Normans believed that soaking live snails and drinking the filtered mixture could coat the throat with the snail's natural lubricant, lubrifiant d'escargot, providing a soothing effect and curing sore throats. This practice was thought to harness alleged healing compounds in the snail's natural mucus. Hey, I've heard of snail mail, but escargot esophagus? Come on!
All right, so you gave me the royal touch
Uh-huh.
or snails for
Unguent for sore throats. Uh-huh.
All right, snail unguent
Mhm.
for sore throats. Which one's real?
Mhm.
Ooh, I could see. I mean, the snail thing. The only thing that leads me away from that is that when I was making up a fake one, I was led in a very similar direction. Like, I was thinking like, oh, snails, slimy. And now you've kind of done that. And that kind of makes me think that we're predictable. No, no. I'm gonna go with the royal touch being real. Is that correct?
You are correct,
Wow.
Gordy. Great instinct.
Wow. I guess that's an example of like, was it the content of the question or was it the presentation of the question itself You know,
That's the
it's
tough
kind of
part.
like that
Yeah.
placebo, but you don't know if it's like how it's administered or the actual content of what you just read to me. That was setting me off right there, setting off the something's not right. Zed's lying.
No, these are hard to write, but no. Okay, imagine being the king, and it's your Monday morning. It's royal touch Monday morning, and you just they got all the peasants and subjects like lined up. You got your finger all warmed up. You're just like, all right, you got to touch a bunch of people with scrofula.
What did you boop them on the nose?
Yeah,
That's what you should do.
Let's get me close to a bunch of people with tuberculosis. Hey, part of the job.
Yeah, he's like, gotta do it. Gotta touch them today. People need me. But Zed, before we continue, let's just hear from another one of our sponsors today. Why settle for the ordinary when your love deserves something timeless? Introducing crocodile dung contraceptives, the ancient natural choice for couples who want to embrace the secrets of Cleopatra herself, reawaken the moonlit nights by the Nile where passion was fierce and protection was, well, unintuitive. Our carefully crafted Croco contraceptive paste is more than just a method. It's a love letter to the past. With each application, you're not just preventing pregnancy, you're connecting with a tradition as old as romance itself. Experience intimacy the way Egyptian royalty did, with a natural touch of dried crocodile dung. Crocodile dung contraceptives, because true love is worth a little mystery, a little magic, and a lot of, well, trust. Side effects may include a deep longing for the ancient world and a lifetime of interesting conversations with your partner. For men, you may end up with a crocodile dung D. That's seen in Sky Mall.
So good.
Welcome back, everyone. We have two more bizarre old medical cures. You ready, Zed?
I'm ready.
All right, one is real and the other is just a trick. Let's see
know.
if you can figure out which one is the trick. I know.
No,
Cure number one.
I really struggled with this before, but I'm ready. All right.
All right, Rick, cure number one.
Yep.
Ground horse teeth for toothaches. In medieval Europe, if you had a toothache, doctors would grind up horse teeth and mix them into a paste, which was then applied to the aching gums. The belief was that the oils from the teeth could reduce inflammation and swelling. Medieval doctors also noted that horse teeth were more uniform and durable than human teeth, leading them to believe that the properties of horse teeth could help ease dental pain.
Okay.
Cure number two, skull fragments in potion form. In ancient Babylon, a bizarre remedy involved grinding up fragments of human skulls and mixing them into potions to treat ailments like epilepsy or headaches. The Babylonians believed that consuming these skull potions could transfer the strength or essence of the deceased into the living, offering relief from chronic conditions. Now, Zed, ground horse toothpaste, not ground horse, that sounds like a groundhog relative. I just mean ground up horse toothpaste or skull fragment potion. Which one is real and which one is fake?
So two variations on basically grinding something to then impart its healing properties. I can kind of see the mindset behind, oh, well, horse teeth are good. We'll grind them up and that'll solve teeth problems in humans. Yeah, that makes sense. Skull fragments. In ancient Babylon, okay, why? I guess they have a bunch of skulls laying around. I feel like that would be maybe a little bit disrespectful to be using human skulls. I don't know. So
Just a little bit.
yeah, I think I'm gonna go just on my hunch with the logical horse teeth one. I'm gonna say that one's real, and then the disrespectful skull fragment. Not that the horse teeth is respectful either, but I'm gonna say horse teeth real, skull fragment, potions fake.
Well, don't tell Esmeralda because I'm about to take your hunch back, because that is
Damn,
incorrect.
No wonder Babylon fell.
That's right. Zed. So ancient Babylonian texts describe the use of ground up human skulls in medicine and medicinal potions. And then they're based on the belief that it could cure neurological conditions. And it was from this like dark magic period, right? The sympathetic magic. And you kind of like, through some sympathetic magic, absorb their dead powers.
Well, that makes sense. Well, I'm still going to try the horse teeth thing, but yeah, damn. All right, you got me. Hope you're happy.
Thank you. I really am.
All right, last round. You ready? You ready to be fooled, or will you see through the placebo?
Let's go.
All right, so these are both sucking related. All right. During the Roman Empire, there were medical personnel attached to the armies throughout the vast empire who were thought to have hereditary powers of healing. They were assigned to give direct suction by mouth to the wound in case of possible poisonous wounds. That's your job. You're just on the apps. They're like, so what do you do? You're like, oh yeah, I'm in the army. And they're like, oh yeah, soldier. You're like, wound sucker, actually.
Yeah, you could say something like that.
I have hereditary healing powers. Yeah, so the historian...
I really wish I didn't tell anyone about them.
But I have a good attitude about it. All right, the historian Suetonius wrote that one of these healers was ordered to suck the wound of Cleopatra to attempt to revive her from the bite of an asp. I'm just doing the thing where shrugging and looking put out. Healer here. Yeah, they wanted me to kiss your asp or something.
Sorry, the radios are terrible. Asp? Oh, asp. Yeah. It's a snake. It's a snake. All right. I thought you said asp. All right, gotcha.
Kiss the asp.
False alarm, boys. Cleopatra's fine.
Her ass is fine. All right. So that's the first one. Roman Empire medical personnel who had hereditary healing sucking powers. All right. Second one. The medieval surgical sucker assistant had an important role doing both debridement, so sort of cutting away from the wound, clearing out the wound, and negative pressure wound therapy by lip service. Before closing wounds, it was necessary to clean the wound, with the assistance of negative pressure. Got it. The sucker would put oil in their mouth first to avoid being poisoned. Otherwise, the other solution was to apply suction cups with a large flame. The other assistant walking in with arms full of suction cups while oil and stuff drips down my chin. You have got to be kidding me. We had suction cups the whole freaking time.
Yeah, I was like, what the heck are this? What's that? It doesn't feel as good. Yeah.
All right. So Roman Empire suckers with the armies or medieval surgical sucker assistants for negative pressure.
Ooh, I'm gonna go with those would be awful jobs. I think the medical surgical one sounds worse for some reason because there's a lot more pressure. If someone's watching you and be like, better do it right. But like if you're on the battlefield, it's chaotic. You can fake suck someone's like this guy's a goner. You don't really, you don't really feel like it.
And the surgical assistant one, you probably have like a cranky surgeon, like, what's taking so long? Not
keep sucking. Keep sucking. Did I say stop? I'm talking about surgeries, Ed. I'm talking about fucking surgery. I am gonna say the real one is the medical surgical suckle. The medical surgical sucker. That is hard to say.
That's the real one. And then the Roman Empire one's not real.
Fake.
All right. Well, I'm going to give you that one, but actually, they're both true, Gordy.
Nuh-uh.
I hit you with a double reel. Yeah, both true.
That's my face right now. What? All right, so those are both true. So someone...
Yeah.
Oh, how do they choose them? Is there do you see anything about the job requirements? Like, what are they looking for?
I didn't see the job description. Well, I saw the job description, not the requirements. But
give me a kiss. Hey babe, I just got home from work. Come here and give me a kiss. Give me a little kiss. You don't really want to.
Only after you brush your teeth with ground horse teeth.
Yeah. Absolutely. But Zed, do you hear that music? It is time for our fast fire questions.
Gordy and Zed's fast fire questions.
And good job on that last one, by the way. I just didn't want to rub it in. I wanted to move along so you didn't feel too bad about losing. So, actually, wait, you tricked me. I just wanted to, I don't know, just put that one behind me.
You allowed yourself to be tricked.
By the way.
But yeah, no, that was fun.
I did. I put myself in that position. But I appreciate it. But anyways, Ed, we have a more pressing matter at hand. It is time, like I said, for our fast fire questions. And as always, we start with our first question, which is, would you rather?
Would you rather?
Zed, would you rather be really strong or really fast? And I'm saying like the strongest man alive or the fastest man alive. But you're going to look the same.
Well,
so sorry about that.
I am already both the strongest and fastest man alive. So saying I'd have to give up one of those things.
Exactly.
What's going to come in handy more often? All right, I think on a regular basis, strength is kind of just be more beneficial. Like more often am I using power in my everyday life than I'm using my speed. But if I was fast, maybe I'd use it more often. No, I would. But there's a lot more glory in winning the like 100-meter in the Olympics. All right, I'm going to go practicality. I'm going to go strength because I guess then I could carry a few more groceries up to the apartment.
Yeah, you do realize you're like setting yourself up for more work is what you're kind of doing.
Oh, true.
Ultimately.
Because everyone's always asking for strength help.
No one's asking for speed help.
No, they're like, can
not like on foot. You know, they're like, hey, hurry, get over here. Be like, I'm going to run. It's like, dude, I know you're the fastest person in the world, but you're still way faster if you could drive. That'd be great.
It would be more work. But yeah, okay, I'm going to stick with strength.
Strength? All right, yeah. I like that. I think that's a good answer.
What about you?
I think I'm going to go with the speed. I think it would be really fun, like, just balling out at sports and stuff. And like, I bet I could get a lot richer off of speed.
Oh, that's a good point. I didn't even think
of that. I bet speed's more marketable
than strength in sports.
I don't know. Each one we could be pretty fun.
Yeah,
just tough. And it by itself probably is not enough either for anything. Even being the fastest person in the world, if you're just like can't catch or who knows. Yeah. But we don't have time to talk about that. This is the fast fire questions, and it's time for a new question, which is how much money we talking?
How much money we talking?
Oh, sorry. Not very excited, but I am. Zed, so I'm going to ask you, how much money we talking to do something? This is inspired by a Penn State football fan that I just read about, that he paid $1,500 for the ultimate Trojan experience at USC and in Southern California. So he could run out the tunnel with the USC team. But he was like, just chose to be completely decked out in the Penn State gear. He was just kind of like trolling them. He spent $1,500 so he could run out with the opposite team, just to be like, haha, losers. Nice. So it got me thinking though, Zed, how much would you have to be paid? Like you get paid to get 30 handoffs in an NFL game behind their line, but just, Zed, we're going to run the ball to you 30 times. How much time we talking? Just one game. How much money we talking?
So I'm the running back, and it's 30 run plays, and I'm running it every time. Oh,
yep.
All right. Well, it would have to be generational wealth because I would die, so I'd want my family to be provided for. So I'm thinking 10 million plus because that would kind of set them up. That would sort of numb the loss of me being dead in a nationally televised football game. And if they invest that right, they could take care of the family for a while.
I think I'd be way less. maybe I'm in a worse financial place.
You're more confident. Well, you're the fastest guy in the world, so maybe.
yeah, exactly. That would definitely change the answer. Because I think I would live. I think it would just like really suck. I mean, I also weigh like 220 pounds. You know, we're not like tiny.
Yeah,
it's just like you're gonna see some of the softest running air. I'm just gonna like get the ball and just like slide,
kneel down. I was gonna say,
just toss it backwards and run off the field.
Because you're 6'5", such a big target, and it's not like you're running.
Oh yeah, by high center of gravity.
Yeah, exactly. Oh
my god. Yeah. So it cost you. It'd be a lot. I think I would do it for $20,000.
Really? But
I just wouldn't want to get hit in the head. But I would get hit in the head a lot.
You'd get hit in the head a lot, and you might not be able to walk the same for the rest of your life.
Well, at least I'll go out doing what I love. All right, Zed, it is time for the final question, the one that is not a question. It is Shock the Doc.
Shock the Doc.
Here's something you probably didn't expect to hear today. I don't know. You probably did. There's probably nothing you're expecting or not expecting at this point. Wombats poop in cubes. Yes, you heard that right, you beautiful idiot. Square poop. These adorable Australian marsupials are the only animals known to produce cubed feces. But why? Well, it turns out the reason is all about survival. Wombats mark their territory with their poop, and the cube shape helps it from rolling away. So on the uneven ground of their habitat. So it just like lands like, hey, wombat poop coming in. And so scientifically, this is possible, Zed, because wombats have a very long digestive process, up to 14 days, which allows their intestines to extract maximum nutrients from their food. And the final section of their intestines has varying elastic properties, meaning softer tissue stretches and firmer sections help kind of like form that cube shape before the poop exits the wombat.
Huh. Yeah, that was going to be my first question is how structurally or physically are they actually generating that? But yeah, it's funny. They're very particular about their territory. It has to be, the poop has to be in just the right spot. God forbid it roll a couple feet down the hill or whatever.
The wombat wife, like, you really have to do the square poops. Like, come on. It's so disgusting. You really doing the square poops again?
Wow. I am shocked. Rarely am I shocked for these, but this one, I'm shocked.
Really?
No, I'm always shocked. And I'm also shocked on this one.
Well, good, because that makes me happy. You know that I could, even just by telling you that you were to be shocked, you would actually feel shocked.
That's a great point. and I'm in pain.
That's something I learned today. And hopefully everyone learned a little something. And so thank you for listening to Going Through Health with Gordy and Zed. Listen each week on Apple Podcasts, Spotify, and YouTube. Apple was working this week. That was cool. New episodes available early Monday morning. Yeah, that was nice, Zed. I like that. Make sure everyone follow us, rate us, review us on Spotify, Apple Podcasts, and YouTube. Please give us 5 stars or whatever the most is. We really appreciate all those followers and subscriptions and ratings and the reviews. It's awesome. Thank you so much. At goingthroughhealth.podcast on Instagram. Please give us a follow, and we have good content coming out multiple times a week. Any questions, email us at gordyandzed@gmail.com, and we will try to answer them. Thank you, Zed.
Thank you, Gordy. And I got a little pill for you, but I'm not going to tell you what it does. Stay healthy, my friend.
Stay healthy, my friend.
Hey, this is Zed. This podcast is intended solely for general informational purposes and does not represent the provision of medical advice or the practice of any professional healthcare services. No clinician-patient relationship is formed. Nice try. And the use of the information provided or materials linked is at the user's own risk. The content of this podcast is not meant to replace professional medical advice, diagnosis, or treatment. Users should seek medical advice for any health issues they may have and should consult their healthcare providers for any such concerns.